This podcast series consists of 4 episodes in total. They are all dedicated to EPICENSUS. EPICENSUS is a UCB-funded initiative to raise the standard of care for patients with psoriasis by gaining insights from patients, payers, and clinicians into the current standard of care and posing potential improvements. This series of podcasts has been financially supported by UCB Biopharma SRL. However, none of the podcast speakers have received any of the financial contributions for being part of this podcast. Hi everyone, it's our second episode of Europso podcast and its name is Education for All. The second episode is in this series, which will be 4 episodes, will highlight the needs for education, not only of patients with psoriasis, but of everyone involved in the psoriasis patient journey. My name is Jelena Misita, and before we go further, I would suggest we go through a quick round of introductions. With me today, I have Jaime and Tina, both Europso members from different countries. Jaime is from Portugal and Tina is from Greece. I am a patient advocate with more than 2 decades of experience in healthcare communication, and Europso board members have unique perspective from multiple angles, both as patients and patient advocates. So Tina, ladies first, would you give us more information about you?
Of course, I am Tina Koukopoulou. I come from Greece. I am a board member of Epidermia Greece, which is the Patients Association, Patients of Psoriasis and Psoriatic Arthritis. Moreover, I am a part of the Europso board and I fight for people who are diagnosed with psoriasis and psoriatic arthritis for many years now. And I'm very happy to be here today.
That sounds great. And you, Jaime?
Yes, thank you. I am Jaime Melancia. I am from Portugal. I am the president for PSOPortugal, the Portuguese Psoriasis Association, and also a member of the board at Europso for a few years now. I used to be a patient, or not a patient really, because fortunately for me, I was diagnosed wrongly with psoriasis, but nevertheless, I joined the association and I've been advocating for the patient rights and fighting for their causes for more than 20 years now. And I'm very happy to be on this podcast because it's the only way that we can get the knowledge and information about psoriasis across not only the patient, but the healthcare professionals and everybody. Thank you.
Thanks, Jaime, for the quick introduction. So now that we've established who we are, we revealed who we are to our listeners, we can move to our main topic. The main topic is, as I said, education for all. And before we go into further details, I would like to briefly stress out the aim of the whole podcast series, which is to explore unmet needs in psoriasis care through first-hand experiences of patients and healthcare professionals and discuss how to address these specific needs. So the podcast will have 4 episodes in total, and this is the second out of 4. The first episode was recorded with David Trigos, who is also a member of Europso board. As a matter of fact, he's a vice president of Europso board, and he talked from both of his roles, one as a patient suffering from psoriasis and psoriatic arthritis, but also his role of a patient advocate and someone who is advocating not only for psoriasis, but through other organizations or for other patients' rights and healthcare issues. So for today, as I said, education for all. Why do you think, if you think, that education might be one of the greatest unmet needs? Why do we feel like that? So what is your personal opinion on this topic? Could you give me more information, Tina?
First of all, when we're talking about education for all, we have to start by talking about the general public. Informing the public is essential, especially about the fact that psoriasis is not contagious. Only through an informed society will patients stop experiencing discrimination and stigmatization. Even if someone has heard that psoriasis is not contagious, that doesn't necessarily mean that he will understand psoriasis when he sees a person with psoriatic lesions. Therefore, it's of high importance to make the general public aware not only that psoriasis is not contagious, but make them be familiar with the image of psoriasis. Hence, education is of crucial importance.
Thanks, Dina. So the general public is one thing, but when we talk about psoriasis, the most affected are normally patients, patient families, but it's not enough that patient knows about his disease. Doctors are very, very important part of this equation. So how do you feel about the level of knowledge that is currently available for doctors or present among doctors? Do we need some improvement there, and why?
If I may, yes, it's quite important. The knowledge of, especially what we call in Portugal the family doctor, which is a general practitioner. It's also important. The pharmacist is somebody or someone else. Is the healthcare professional that lots of times people with skin diseases, they show to the pharmacist some kind of lesion and ask him, what can I do for this? What kind of cream can I use here? This is very common. So it's also important that the pharmacist is knowledgeable about psoriasis or skin diseases in general, so we can recommend a proper reference for a dermatologist for these persons. And especially the general practitioner must be aware of psoriasis, and that's not the case in Portugal. And I think it's somehow all over Europe that the knowledge about disease, this skin disease, is lots of times confused with just a normal a kind of condition of the skin. This is not a condition of the skin; is a serious disease, is a chronic disease, and the normal type of psoriasis, the plaque psoriasis, is not that difficult to diagnose. When it looks like that, it's not difficult to see this psoriasis. So it's very important that the patient can be, if the general practitioner has the proper knowledge, he can even treat the moderate or the not so severe cases of psoriasis can be treated with topics by the general practitioner. But the best thing is to actually, if he's not knowledgeable enough about the treatments of psoriasis, to reference these patients to the dermatologists. And even dermatologists, they have different areas of knowledge as well. So a dermatologist that actually knows how to treat psoriasis, because not all of them know how to treat psoriasis. So it's important to have this in mind as well, because if you are not treated properly since the beginning, you can spend years, not being treated properly, and that is not good for anybody, especially for the patients. If they are not treated properly since the beginning, they can go through more severe situations with psoriasis and other comorbidities. Psoriatic arthritis is one of them. 30 to 40% of the patients can go to the arthritis. Is quite severe as well on their capacity to do their normal work. So it's important, like Tina said, for the public in general, it's quite important because of the social stigma that is associated with the psoriasis patients. They suffer a lot with social stigma, and it's important that the general public is aware of this disease. And we are people like any other people, and we have the same skills as everybody else. We just have this skin that kind of falls off our body, once in a while. So it's something that is related to everybody, but especially with the healthcare professional, he must be informed properly how to treat psoriasis. That's an important thing. Probably the most difficult thing is the access to that doctor, which is kind of a problem, because in the big cities, in the big hospitals, you have all these kinds of specialties, dermatology included. But if you go to small hospitals in the country, it's very difficult to get a dermatologist on the healthcare system, or even on the private sector. So we have a problem, not Houston. We patients have a problem.
Well, it's not easy to hear that patients have a problem and you say it with a smile, which means that more or less either you are on your path to find a solution or you have find your way to live with the problem.
This is a good opportunity to mention that
this podcast series is more or less revolving around calls to action from EPICENSUS. EPICENSUS is a broad initiative that anyone can find out more about. When you type in Google the words EPICENSUS and psoriasis, the full paper will be available for you in one click. And more or less, both things that you underlined here are in one of the major findings, which is improving psoriasis awareness, which Dina mentioned and talked about. We need to educate general healthcare providers as well, as you mentioned, Jaime. And that way, patient will know his condition better. General public will know how not to stigmatize someone just because his skin is inflamed. And general practitioners and healthcare providers will be able to recognize the disease in time without any mistreatment or wrongly diagnosed patients. And the other thing is understanding related health issues. Also, one of the findings of EPICENSUS was that dermatologists should know more, not just about psoriasis. And you say, Jaime, some of them don't even know enough about psoriasis, some dermatologists. And now we have to also move to the next issue, comorbidities. We know for certain that psoriasis affects more than just skin. So the thing is, how do we move further? And do you think it's needed for dermatologists to know more about other diseases that are interconnected with psoriasis and how this could help patients on a long run?
Definitely, I think it's a must. It's something that even we as patient advocates or patient organizations, we can do something proactive there, doing webinars for general practitioners, for pharmacists, together with the dermatologists, the ones that we work with. Normally, all the associations work with, consultants, scientific consultants, and with them to promote I don't know the name in English, but we call it the orders of the doctors or for the doctors and the orders for the pharmaceutical people, to give this training to them. This is quite important, and especially when we're talking about the diagnosis. The first diagnosis of psoriasis is sometimes not taking too much attention to that, but one of the healthcare professionals that should be there as well, or at least the patient should be advised to consult, is a psychologist. It's quite important for all the mental health issues that the patients face on the early stage of their diagnosis to be, if they are not knowledgeable enough, sometimes the doctor don't have the time to spend with the patient to properly address them about all the disease, all the frame, let's say, of the disease, all the things that can happen to him, and having this conversation with the patient, for a period of time that is completely aware of what he can expect and what he should do, and what the importance of complying with the treatments. All this should be done perfectly with the psychologist to address all these issues, or even if the doctor has no time for that and there is no psychologist there, with the nurse. The nurse normally have more time to spend with the patients, especially patients that are doing biologics. They normally need help from the nurse for the injection and all that. So is a healthcare professional. It is quite important as well to be with the patients. So let's say there is quite a range of persons, a range of people, or healthcare professionals that could be used, in order to give this holistic kind of treatment to the patients. But I have this focus on the mental health issue because that's quite important, even for the efficacy of the treatments. I don't know if this is the correct word in English, but anyway, if the way that the medicines work with you, it's important that you are on the mood, to accept this treatment, because the treatments are not effective right out of the box. It takes some time to produce the desired effect, to get your skin free of lesions. So it's important that this conversation is done by a professional. Sometimes it's the family that does that, but it's important because they are the ones that should do that. And it is quite important even for the efficacy of the treatments to work better if the patient has their mental health, not in good shape, because there's never in good shape, but at least properly taken care of to address this disease.
Tina, do you have something to add?
I would like to say that I agree with Jaime here, because more than half of patients diagnosed with psoriasis report that the disease has a significant impact on their quality of life. Therefore, it is important that all patients who throughout the diagnosis and the whole journey with the disease are anxious to maintain their quality of life and try to reassure for themselves independent living and attempt to enjoy everyday life. So is that a success story? Do the patients succeed in doing so? The answer is not the same for all patients, and it's closely linked to the severity of the disease as well as the flare-ups and the remissions. So it is important, if we're talking about the therapeutic goals of treatment, to comply with the treatment and follow the instructions given to us by the doctors. As patient representatives in all our patients' associations throughout Europe, we urge our members to visit the special doctors. The main advice that we give to them is to follow the instructions and the advice of the doctors. And for psoriasis, the right doctors are the dermatologists. So we encourage the patients to contact them for any questions and to actively participate in their treatment. This is the only way we can achieve our therapeutic goals as patients with psoriasis.
That being said, and for patients to be informed to reach their treatment goals, how well are actually patients informed? What is your experience? Are there enough patient-friendly information? Because frankly, one of the major EPICENSUS findings is that in fact, patients are lacking these kind of things. They should be able to easily find clear, easy to understand information about their condition, but also to have option to access to various platforms and to ask questions to doctors or whoever when needed. What is your feeling? Is this met or is this still unmet need?
It's still an unmet need, and we can do some work there. We patient associations, and especially because we normally have the information that we can give to the patient. We have the good resource of that information, at least. So to avoid patients to go to the Google and see so many things that are completely out of what they should be doing, and some kind of miraculous treatments and all that. This proliferates all over the internet. So it's one of the things that we can do is to do some kind of campaign with the dermatologists. Like I said before, they normally don't have the time to do that in the consultations, but at least they can inform the patients, look, there is a psoriasis association in your country, or whatever location you are, so that they can actually give this to the patient on an easy way and say there is a card or whatever, a link, whatever they can give to the patients and send them to the patient associations, and we can actually give them proper information. That's something that we should do. That's our duty, is to do these kind of things, and we are confronted with this situation. We cannot get more time for the dermatologist to be with the patient. We cannot get dermatologists to be all over the country, but at least we can give this information to them so they can pass it to the patients, and then we can do, let's say, our job on advocating and educating the patients properly. That's something that we should do. Of course, we need support for that. We need the financing for these things, and that's our job. Looking for it.
Ina, please add something to this, because I feel that you have a lot of personal experience to add to this.
It is very difficult, especially for a naive patient, to have a new diagnosis and try to find out what is happening to him and what the future might bring when it comes to the disease. So once again, I agree with Jaime, because the medical community must join forces with the patient community. Education is of high importance, and patient associations and patient umbrellas like Europso can play an important role, especially now with the internet, so the patients can be validly informed and follow a nice and valid path and avoid negative feelings.
This is very valuable insight, and thank you for sharing this. So to recap shortly, we identified three major unsatisfied needs, which are needs for patient-friendly information, for improving psoriasis awareness and for understanding related health issues, especially for doctors, to understand that psoriasis is more than skin deep, as is the name of our first episode. So when we try to summarize this for someone who's been listening from the beginning, what would you say? Where are we on a scale 1 to 10? Where are we in satisfying these three things? When we talk about patient-friendly information, availability, and preparedness, where are we on from 1 to 10? What do you think?
It's hard to give a rate and say where are we, because that depends on the patient's willingness to look and to participate in a patient's association. Patient associations do have information online. Patient associations provide useful leaflets in all aspects that are related to the disease and can really truly help especially during the first steps from diagnosis to treatment. But there is a long way to go, a long way to come, and it is clear that knowledge is power, and it is clear that the more empowered the patients' association are, the more they can provide to all the patients throughout Europe.
I could add to that if I have to do a rate, at least, I'm a bit more knowledgeable about Portugal, but I think you can extrapolate for most of the countries in Europe. Like I say, 20 years ago, 20 years ago when we started our association, if we asked somebody on the street, do you know about psoriasis? What do you know about psoriasis? The answer was normally, I know nothing about psoriasis. Nowadays, if you do the same question, normally what people say is, I know somebody that has psoriasis. Friend, family, whatever. And this is also related with the numbers for prevalency, that 20 years ago, we are saying something like 2%, 2 to 2.5%. This was an international figure. It was 1 to 3%. Like I say, we are on these kind of latitudes. We said 2% was more or less a good figure for Portugal, at least. And we say something like 200,000 because we are 10 million. I would say something like 200,000, more than 200,000, 250,000. But the study we made last year, it reveals that in Portugal, we are more than 440,000. So it's the double of the numbers that we thought we were. And this is not because the number of patients has increased for the double. That's not the issue. It's the knowledge that there is nowadays about psoriasis. And that reflects on the answer people give on the phone call from the marketeers that did this study. So it is something has been done. Probably 20 years ago, we were on the level 1. I will not say 0, but on level 1. Probably now we're on level 4 or 5. But what concerns knowledge is more to be done because we don't reach everybody. We never do that. If we are 400,000 people in Portugal and my posts on Facebook, just at the most they show 10, 11,000. So there is lots of people that is not probably aware of that, or they have other sources, of course, but this is a kind of an indicator of what actually is the reality. So it's something has been done, and I'm not defending my causes, but that's the reality. That's our work. That's what have been done on these last years, is informing people, everybody know about psoriasis. And this has a reflection on the evolution that was done on taking care of the psoriatic patients. But lots has to be done because we lack still the access to the dermatologists, we lack access to proper treatments. So there's lots to be done. Telemedicine is one way to help to this. Is some teleconsultations is not the ideal thing, but it's better than nothing. It's better than nothing, especially if you don't have access on your own town, on your own village to a dermatologist. Probably something that we should look into. It's not the ideal thing, but probably is a good way to at least have some professional to taking care of you, and probably then can refer you to a presential consultation, but with some more, information, and something has been done in the beginning. So it's a lot of work to be done, but a lot has been done as well.
Well, obviously, this is a hot topic for all of us, and that's why we have a lot to say about these things. And we talked also about raising general awareness and the role of patient associations in education of patients. But patients, as we said at the beginning, are not the ones and not the only ones that need to be educated. So how how do we even begin to brainstorm on how to educate general healthcare providers so they can recognize psoriasis better? So this leads hopefully to faster diagnosis or timely referrals to dermatologists, more comprehensive approach to care and treatment. How do we reach medical professionals? Do you think that maybe what we are doing for patients, medical professional organizations, dermatology societies from each country should be doing among their ranks, and how the synergy between our two worlds can be achieved?
$1 million question. It's not much you can do. We have to fight and talk to everybody and go to the authorities, to the governments, and fight for our causes. And that we need more dermatologists, we need more students, addressing they have to create the conditions for more young dermatologists to follow this specialty. We have to improve the system itself, like I said, with these other solutions like telemedicine, which is something that I'm not saying this is a good thing from the pandemic, but it's some opportunity from the pandemic. Most of the people now is using WhatsApps, video calls and all that. So people is not that far away from these tools, so they can, even the people does not have a good literacy in computers, but nowadays with the mobile phones and all that, they can do video calls. So let's start using these tools. Some apps, some artificial intelligence is something that can help us as well, being used properly. So let's bring these tools, that are starting to be available now. But because to get more dermatologists on the right place, all over the place, is some things that will take years to achieve. And you should not, thinking about that these days. We should think about trying to find other organizational solutions and other tools that we can use to help patients through that journey. That's quite important.
I totally agree, Jaime, and thank you both for your precious input. As we said at the beginning, your role is really unique because you can see things from multiple perspectives, unlike other people. And it's very important to educate people. It's very important to educate both patients and doctors and family members. This can be achieved, just to summarize it shortly, if I understood correctly, this could be achieved through public campaigning, but also through multi-sectoral collaboration between patient organizations and medical societies. And together, these two should be able to approach healthcare decision makers and get better conditions for psoriasis treatment and care in future. So with this, I would like to close today's episode and thank you both for participating in it. Thank you, Jaime, and thank you, Tina.
Thank you
Our
for
pleasure. Thank you.
us.
And I'd like to use this opportunity to announce our next episode, which will be all in this together. And just a hint of what we are going to cover is that psoriasis often causes other conditions and is interlinked with other conditions. And people seem to be not aware of this the way they should be. So we plan to cover this. And this episode, the next episode, will be covered from a medical healthcare professional's angle. So we will have opportunity to talk to doctors treating patients, giving us their perspective on this particular issue. And with this, I would like to thank you both again, and to our listeners, keep up with us and wait for our next episode. Thank you and bye. Goodbye.
Goodbye.